The therapeutic relationship. It doesn't take big nursing organizations to tell us that the therapeutic relationship created between a nurse and patient is the psychiatric nurse's most impactful intervention. It's something we pay close attention to each and every interaction, including when we're first introduced to the patient. But let's back up for a moment and clearly define what a therapeutic relationship actually is and what it's not. When comparing it to a social relationship, there are some stark differences. In a social relationship, the purpose is connectedness, socialization, or collaboration on a task of some kind, such as when neighbors join forces to clean up a vacant lot, or when family and friends come together to celebrate. There's a mutuality about those relationships. Everyone takes turns being listened to, and everyone's needs are important. Roles can also change depending upon the situation. In the therapeutic relationship, the focus is unidirectional. The nurse and the patient focus exclusively on the patient's needs with no reciprocity towards the nurse. This is the nurse's job. It's not a give-and-take friendship. While the work should meet the nurse's professional and financial needs, the nurse's social and emotional needs must be met with people who are not patients. We must be fully aware of the physical and verbal messages we're conveying and ensure that we are communicating therapeutically. This boundary is for the psychological safety of both the patient and the nurse. As soon as a nurse starts to feel unappreciated by a patient, thinks a patient has been rude towards them, or has a desire for a patient to like them, the nurse has unconsciously wandered outside the boundaries of the therapeutic relationship, and the needs of the patient are no longer the central focus. Remember, the key characteristics of a therapeutic relationship include being kind, authentic, non-judgmental, respectful, honest, empathic, and accepting.